Hello everyone, welcome back to my channel. My name is Carissa Conrad, Doctor of Physical Therapy and Therapeutic Pain Specialist, and I am the Vagus Nerve PT. Anointed Messianic asked if I could look into what the research says about vagus nerve stimulation and painful bladder syndrome, or otherwise known as interstitial cystitis. And this was another really interesting research adventure that I went on. Essentially what I'm finding over and over when I look into these different conditions is that there is some element of nervous system dysregulation that is associated with these conditions. And nervous system dysregulation just means that there is more sympathetic nervous system dominance rather than parasympathetic nervous system dominance. So parasympathetic state, again, that's rest and digest. That's where we feel our best. That's where we connect to other people. That's where we heal. That's what we want to be dominating our nervous system the most often. In painful bladder syndrome, there is a sympathetic dominance. So it is theorized that vagus nerve stimulation would be helpful because, once again, it establishes that parasympathetic dominance within the nervous system. In addition, the vagus nerve stimulation modulates bladder function. It is also theorized that that would assist in the symptoms of interstitial cystitis or painful bladder syndrome. There are no randomized controlled trials done yet. Again, with this condition, they are in the works because these theories are present. And I would add to this that in addition, just looking again at the fact that this is a chronic pain condition, if you've seen any of my other videos on how vagus nerve stimulation can help with chronic pain, I see it time and again in the patients that I work with in person who have chronic pain that vagus nerve stimulation helps. And there are a number of reasons for that. One, again, if you remember in my other videos, I talk about the fact that pain is an experience produced by the brain based on how threatening it feels the information is coming from that location of pain. So if we bring the nervous system out of fight or flight into rest and digest, into parasympathetic, that information coming from the area, even if it's the bladder, the lower abdomen, is less of a threat to the brain. And so the brain is going to respond by decreasing the pain experience. The other reason that I mentioned in my other videos, and that's also mentioned in the theories about why this would help with painful bladder syndrome, why vagus nerve stimulation would help, is that vagus nerve stimulation decreases the release of inflammatory cytokines. So again, any chronic inflammatory process is typically going to be helped when we're stimulating the vagus nerve. I hope that's useful. Thank you again for watching. Keep letting me know what conditions you'd like me to take a look at. We'll see you on the next one.